Hello, everyone. We are so excited to be with you today for our Disabilities Diversity Book Club Case 14, Student with a Service Animal. I want to start by letting you know that this book club is brought to you by the Access and Medicine Working Group within the Docs With Disabilities Initiative in partnership with AHEAD. The Docs With Disabilities Initiative uses research, education, and sharing of stories to drive change in healthcare education with the goal of building more inclusive educational environments for trainees with disabilities and to increase the representation of disabled providers in the healthcare workforce. The goal of our book club is to introduce varied perspectives and encourage empathy for all stakeholders in the health science setting. Today, we're going to be working together through the case, and what our goal is to empower you all by learning from each other about best practices, policies, and procedures to apply this knowledge so that you can confidently navigate complex cases on your campuses. Let's do introductions. I'm Jennifer Gossett. I'm the ADA 504 Compliance Manager at Portland Community College, and I have over 15 years experience working as a disability resource professional at a variety of different institutions, including I spent 5 years as director for the Office for Student Access at Oregon Health and Science University, working with all health science programs at the university. I'm also a board member on the Coalition for Disability Access in Health Science Education. And I was recently an instructor for the Disability Resource Professional Academy through the Docs With Disabilities Initiative. Linda, would you like to introduce yourself?
Sure thing. Thank you, Jennifer. Hi, everyone. My name is Linda Sullivan. I am the ADA 504 coordinator for Dartmouth. I have been in the field of disability service provision in one capacity or another for over 30 years and have been in education for a little bit longer than that. So I'm really happy to be here today and look forward to going through our presentation with you. So first things first, we want to say thank you to all of the contributing authors to the book that we are working from. On your screen, you will see the following names: Alicia Booth, Carrie Morgan Eaton, Catherine Moore, Charlotte O'Connor, Christine Lowe, Christopher Connolly, Elisa Laird, Elizabeth Kane, Hilt Meckhaber, forgive me if I butchered your last name, Jan Sarantino Cox, Joseph Murray, Christina Peterson, Leslie Neal Boylan, Lisa Meeks, Marie Lusk, Maya Hammond, Michael Argeni, Michelle Miller, Nicole Taylor, Patricia Lucier Dunstey, Rachel Gupta, Samantha Schroth, Sharon Goulet, Stacy Carroll, Stacy Jones, and Susan Hawks. Thank you for your contributions.
Today, we're going to be talking about the student who brings an animal to class. This chapter in the Disabilities Diversity Casebook, it was written by Patricia Lucier Dunstey, Christine Lowe, Elisa Laird, and Leslie Neal Boylan. So we'd love to lift them up and say thank you for those contributions.
Just a few reminders about our presentation. This is a space for learning and connecting. No one here has all the answers. We welcome questions at all levels. Please remember to be mindful of your contribution time to ensure opportunities for others to share and connect. This is not a space for individual group consultation regarding current student situations. And most of all, please remember to navigate this space with humility and respect. Thank you.
All right. One of the most important things is we want you all to engage in this discussion. One of the goals of the book club is that we learn from each other. And just like Linda said, no one's an expert in everything. And we really want to hear from you as participants. How this is going to work is you will be able to raise your hand and I will unmute you. Please post questions in the Q&A. And if you haven't done so earlier in the presentation, please feel free to introduce yourself in the chat so folks know who's participating today and we can all work together to go through this case and learn something new that we can apply to our practice.
Okay, a little more housekeeping. So this is our agenda for today. We're going to review the key points of this case. It's important to think about the case from the various perspectives of all of our the people that we work with. So we're going to think about it from the student's perspective, the medical school itself, and the disability resource provider. Then we have a series of guided questions to help you all think about what this case means and how to best use this. And we will open this up at the end for questions if time permits.
All right, time for a review of the case. So for those of you who maybe didn't complete all the pre-reading, we're going to go over some of the history so you can follow along and take part in this discussion as well. So we have the student named Tom and a dog named Winnie. Tom is a second-year nurse practitioner in the nurse practitioner program. We do not know if Tom has a disability diagnosis. We do know from a tidbit in the case that Tom experiences some social difficulties, but we don't have a lot of details on that. And he does not receive any official accommodations currently.
So some history around Tom and Winnie. As far as background is concerned, there are no known accommodations or a known disability for Tom. In the clinical situation, his performance has been good. It's been strong, and he's progressing in the program. Tom does not take Winnie to any clinical setting, but he does have, Winnie is a volunteer therapy animal at the local hospital, and Winnie accompanies him everywhere he goes. The challenges for the case, as we see them right now, Winnie makes Tom feel better or feel good. And the instructor assumed that Winnie was a service animal and allowed the animal to stay in class for a number of weeks before the dean said that Winnie couldn't be there due to the no pets policy.
Okay, so we have several concerns here that we need to address. We've learned that Winnie is not an identified service animal. So Tom was not able to answer questions about work, what work Winnie performed or tasks that Winnie performed to mitigate the impacts of a disability. What we don't know if Winnie is an ESA, also known as emotional support animal, because Tom has not initiated an accommodation process in the Disability Services Office. Like Linda stated, the instructor has allowed Winnie to be in class for a few weeks. So there's been a precedent set of the dog being allowed in the classroom. And another challenge or concern is that we don't know if there is a service animal policy, ESA policy, or therapy animal policy at the institution.
So now thinking about this from the perspective of the student, he's had this animal in class for a number of weeks, and now the dean comes to him and says that Winnie can't be there. So from Tom's perspective, Winnie is allowed at the hospital when he's a volunteer therapy dog. This is a classroom setting. It is logistically easier for Tom to have Winnie with him rather than have to go back and get Winnie to go to the hospital after class. Winnie's presence makes Tom feel better. And the instructor allowed Winnie to stay. His classmates love Winnie, so he really doesn't assume, why is this a problem?
Perspectives of the institution. There is a no pets policy at the school. So that could be an issue for multiple reasons for Tom. Also, Winnie does not qualify. Winnie does not meet the definition of service animal as established by the ADA. And we know that Tom has not requested any accommodations for a disability.
So now thinking about this case from the disability resource provider. Tom isn't affiliated with their office. Service animals don't need or don't require the student to register with their office. So if Winnie was truly a service animal, Tom wouldn't necessarily be affiliated with their office. But Tom didn't indicate that Winnie was a service animal. Tom also didn't indicate what work or task that Winnie could perform. Tom can make a request for Winnie to be allowed with him as an ESA for a disability as a reasonable accommodation.
All right, now to the fun part. This is where you all get to step in with your perspectives. So our first question to explore today is, what are your initial impressions or concerns? What do you think you can do to support the student immediately? And I also like to think about the perspective of the institution. What could you do to support the faculty, the dean involved, and the institution as a whole? So if you would like to jump in and share some perspectives on this question, which we would love you to do, please go ahead and raise your hand and I will unmute you.
I, for one, can say that I've had this happen, and it's a very difficult place to be when you have an animal that's in a classroom and has been there for a part of the semester, and all of a sudden you're in a position where you have to say to a student that animal shouldn't be there, but everything's been going along just fine. Jennifer, have you had any situations like this in your career?
Absolutely. I have had students that have been bringing an animal onto campus, actually that almost nearly identical to this case. The only difference was the dog in this case was not a therapy animal doing visits in the hospital, but there was a dog coming to campus that some faculty members allowed the student to bring to class with them. So certainly this is something that has come up for me in my practice. I want to also mention, if you don't feel comfortable maybe speaking out loud, you can put questions in the chat or the Q&A. We have a question from the chat. How did I handle the situation? Thank you, Elena, for the question. Well, because a student was not connected with my office, it seemed a bit inappropriate for me to kind of cold call or send an email to the particular student. One of the inquiries I made at the beginning of learning about the service dog from one of the program staff was asking if the dog was presenting any issues behaviorally. And I don't think the answer was yes to that. It's been a while. But also one of my questions to the person who called me about this was kind of helping to inform them about the rules and regulations of service animals, because, you know, as we know, or if we don't, we're going to be providing links to resources from the ADA about definitions of service animals, the rights and responsibilities, that service animals are allowed generally in areas if they perform work or tasks to mitigate the disability. So we can't necessarily just assume that the dog isn't a service animal because of the breed. It was a small dog. So I do see an attendee raising their hand. Give me 1 minute. Hi, Jackie.
Hello. Okay, so I have an initial impression / how I would help the faculty, dean, institution, and then a question. So my initial impression would be, I think where education is important here, that we need to educate the student, really indicating what the difference is in between what a service animal is, what a therapy animal is. It's funny, I literally just had this talk with one of the counselors in the building regarding what the difference is and how we need to tell students what that is, because we have a pharmacy program that just had a paw day where dogs came on campus. So I do think that's really important. It's just educating everyone about what that difference is and what we should know too about not calling out the student, like you said, but then giving them resources to making sure that is a service animal something that's needed? And then I was curious in regards to, you indicated that it could be an emotional support animal in the previous slide. So in my thoughts there, and maybe I'm understanding incorrectly of what an emotional support animal is, but from that, our emotional support animals typically they stay within the housing setting, correct?
That's a great topic, Jackie. And that used to be the thinking. The thinking used to be that the emotional support animal only could go as far as the door, if you will, of the residential space. But that's been changed. There have been cases that have come through, and there's a case that's referred to in the book chapter that talks about the responsibilities of each school to evaluate the request for an emotional support animal in a classroom setting or in another setting on campus. And you would navigate that process the same way you would any other request for accommodation.
Got it. Thank you.
Who else wants to speak to question number 1? Give it a moment before we go on to the next question. Any other things to add, Linda, for perspectives on these 3 questions?
I think the idea that this is a volunteer therapy dog would be something that I would explore a little bit, and I would explore that with the dean and the faculty member in the class. Is this a learning opportunity for all the students in the class around what a therapy animal does, what the distinction of a therapy animal is? I think it's a great chance to kind of use that moment for aspiring nurse practitioners who are likely to run into this in various settings, how a therapy animal may be really beneficial in the clinical space.
Yeah. All right, let's go on to the next question. All right, question number 2.
Okay. So as the disability service providers in the room, or the disability resource providers, I still haven't made that switch fully. What do you know about this case? What's important to you? What sticks out? And what do you need to know? I think one of the things here that's important to think about is, what is the question that's being asked of you? So are you being asked to evaluate whether or not the dog can stay? Are you being asked to determine whether or not there is a reasonable accommodation to be had here? What would those 2 questions, would anything about those 2 questions, would they guide your thinking differently?
All right, we have Emily McGee. Go ahead, Emily.
Thank you. One of the questions I also have would be, what does the student want to happen next? We know that they've been bringing the dog to class with them, but now that they've been made aware of the no pet policy, does that change how they would like to proceed? So that would be one of the main questions that I would want to know also, is just kind of, where's the student at and what's their perspective? And then I guess I would also be curious as to what again really spurred bringing this up. If this has been going on for a few weeks, not that it's right, we should always be following our policies, but was there a complaint made by a student? Was there a disturbance somehow? How was this really brought to the surface, and why at this point was this brought up?
I believe the case talked about the instructor quite by happenstance, saw the dean, made a comment that the class had a mascot, and the dean then went into further conversation about it and asked more questions. But those are great questions, Emily, because lots of times you could find out that there's a complaint. I had a situation once where this was happening in a classroom, and it wasn't until 2 animals were in the hallway and they were having a problem with one another that we became aware that this was even happening. So these kinds of situations can come up often and in strange ways.
I absolutely agree. We've heard from the dean at this point, but we don't know if there are additional layers. we don't know if the faculty is just totally an animal person, and maybe there are other students in the class that are uncomfortable, but they haven't been felt empowered to speak up. We only have one perspective at this point. And so I think you bring up a great point, Emily, on kind of finding out more about the different layers, different perspectives, things like that, because it can be important.
What allows Winnie to be able to visit patients in the hospital is their documentation. This is from Andrew Quigley. Well, that's a great question. Great couple of questions, Andrew. And in this case, unfortunately, we don't know, right? The case talks about Winnie as being a volunteer therapy animal, and what criteria a person has to have, or a dog has to have, in order to have their animal be a volunteer therapy animal, I don't know, but I can make some assumptions. I mean, therapy animals perform a specific task that they help the process of the therapeutic relationship, right? So a volunteer therapy animal, what kind of qualities do you think that they would have to have in order to be in a hospital setting?
Yeah, I agree with that. For me, a couple things that I want to know is, what are the policies? What are the guiding procedures related to those policies, if they exist? Dealing with the precedent in terms of how the institution may or may not be at slight risk because they've allowed the animal in the class, and now we're taking that away. We want to make sure that Tom was not regarded as a person with a disability, right? Because the ADA protects folks that have been regarded as having a disability. So needing to unpack kind of all the layers and get information from all the perspectives. And one thing I would like to know is kind of make a game plan with the dean and the faculty on how to communicate information with Tom. I think we have another question in the chat. I'll read it this time. Therapy animals typically need to pass an evaluation, and if they pass the program that passes them, often they offer insurance coverage for the team. So the team would be the handler and the dog. Thanks, Jean. All right, Linda, should we go to the next question?
I think that's a great idea.
Awesome. All right. So if you were in this situation, you're the DRP, how and where might you find new information that may lead to enhanced access? So what kinds of information would you be looking for, and where would you get that information? Again, feel free to raise your hand. I'll unmute you. Hop into the chat.
Elena, I'm sorry if I said your name wrong. She commented that she would look for the ADA website. That's great. Thank you.
And again, we'll be providing the link to the service animal information from the ADA. Jackie, the Health Coalition listserv. So the Coalition listserv, great resource there.
Oh, it's Jade. Jade is registered as Elena Willard, should also be on the call. Okay, so welcome to both of you. Thank you for your input.
Other sources of information. Jean says in the chat, it feels like the place to look for information would depend on what the student shares is the reason for bringing the dog. That's absolutely right. And I want to go back to something that Jackie brought up. It is a common misconception that emotional support animals, and it's been a thing that folks have been saying for a while, ESAs only are for housing, not the classroom. But again, OCR in particular does not like blanket denials of accommodations. And we must, when a request is made, we must consider those requests on an individualized case-by-case basis, right? So It does depend on how Tom responds in this case, what information and resources you might seek out. Is he saying then actually when he is a service animal? Has anyone ever had that happen? Where you find out about an animal on campus from someone else, whether it's from the student themselves who has been denied access or a faculty member, and it turns out that upon learning the definitions of the different categories of animals, the student claims that the animal is a service animal? Has that ever happened to anyone? Jean says yes. How about you, Linda?
Absolutely. And I work in a state now, and at my previous institution, different state, same rule, service animals in training or service dogs in training can be considered service animals. And so I have had the situation where we were questioning whether or not an ESA was the right situation for a student who very quickly turned around and said, actually, it's a service animal in training, and was able to answer the questions that we are allowed to ask. And so we very much had to walk a very fine line with that student for a while as she brought this very young animal onto our campus.
All right.
Anyone else? Has anyone else found themselves in that situation?
Jackie says yes. We have Emily in the chat saying, I had a student claim it was a service animal, but could not answer the second of the two questions.
I often get an answer that petting the dog makes me feel better. Oh, yes, yes. And obviously that's not the dog performing any tasks. So we have a fundamental problem with the definition of a service animal if petting the dog makes the person feel better.
Yeah, and I want to speak to the challenge of sometimes, when we have to deny an accommodation, I personally benefit, I think students benefit from a transparent approach, and that's my approach, in terms of why I'm making that decision, what my reasoning is, and helping to educate them. And I also am very clear when I need to say no, the reasons why. And it's not because necessarily I'm saying they don't need what they're asking for. It's just not in alignment with what we can do at this point as an institution. And I feel like having that empathy while also communicating clearly can be a very helpful approach. Jean, I'm going to unmute you. Go ahead, Jean.
Can you hear me?
We can.
Okay. It became too long to type, and I might be jumping ahead too fast. But what I wanted to say was, if we find that this student, it isn't a service animal, it's convenient for them because they have to go right to the hospital, and it seemed like no one in the class mattered, and it mattered to them. And if it comes forward with that level of clarity that it isn't a service animal, but the student, in order to volunteer, they need to bring the dog, and what can we do? They've been doing it all half the semester. I realize there's a pet rule, and I'm also from Vermont, and if you tend to not like dogs and you live in Vermont, you're like looked at poorly. So most people who don't like dogs in Vermont would never confess to that. So what I may be finding something to help the student so that they can continue the commitment they've made, that are precedent in allowing the student to set up their schedule for this semester. So maybe the student can just put a dog in the crate in the corner of the room, or just to be flexible with that pet policy until the end of the semester, if that's where the problem is. And I'm sorry if I jumped ahead 1,000 questions, but I'm just thinking that if we really find that the student was just doing it for scheduling reasons, they didn't want to pursue an ESA or a service animal, then maybe like a meeting in the middle kind of component versus just saying, you can't do this.
I love that. I really do love that. Thank you for bringing that up, because from a student support perspective, there's nothing that prevents us from referring Tom to additional resources that may be available, or helping to creatively problem solve exactly what you're talking about through scheduling. Probably depends on the cohort program and getting flexible with what time, like you said, that the dog can go into volunteer at the hospital. But I love that. Creatively thinking about support resources to bolster if you do have to say no. Hey, we can't do this, but guess what? I have some ideas if you're open to hearing them about maybe creative ways around the issue you're having. Linda, anything more to add on that?
Just echoing what you said, I really love that idea, Jean. I think it's great to always try and come out with an answer where everyone is as whole as possible. If it's a situation where Tom doesn't have a need for this animal, or if maybe there is a need, but we have a process that we have to go through while evaluating that need, you know, we can think about things like temporary accommodations. We could think about a temporary solution of having the dog in a crate nearby or in your office, right? There are things that we can do that will help create access for Tom, allow the process to continue, and really keep everyone as whole as possible. Okay, this one's kind of loaded. So, how might the structure of your institution's policies, processes, available resources help or hinder navigating a similar case? Let me ask another question. Do you all have service animal or animal policies on your campuses?
Yeah, post in the chat whether you have a policy, don't have a policy, or don't know, and there's no shame either way. We have several people raising their hands. I love it. I'm going to call on Mary Anna first. Mary Anna Gibbs, go ahead.
Oh, there, the mute appears when you select us. Okay, I see how it works now. So we actually just rewrote our policies, or actually wrote policies. We didn't really have a lot in place because we were actually having some concerns with, we had approved 2 ESAs on campus, and then everyone kind of started bringing their dogs to campus thinking it was a thing that anyone, you know, could bring them. And then we were running into some issues with how people were disposing of waste, leaving dog beds in rooms, dog hair being all over study rooms and spaces, and just some different concerns. So we just rewrote all our policies, really laying out, you know, we even created a service animal registry that's not required, obviously, but like to encourage people to register their service animals so that it would just help us make sure, first of all, that they have all the resources they need if someone does have a service animal, and it would help make campus safety aware of which animals were service animals so they wouldn't be asked questions and things like that. Obviously, again, not required, but we added that in there as like, hey, if you want to let us know, you know, we can provide all these resources for you. But just also laying out the difference between ESAs, therapy dogs, whose responsibility the care for the animal is. We had a student asking for a dog park and things like that. So just kind of laying out all these different things, you know, that is a student responsibility versus, you know, in terms of providing this care for the animal and things like that too.
Absolutely. Thank you.
Yeah, and leashing was a big thing. Leashing, when an animal could be on leash, off leash, service animals versus ESAs, things like that.
Thank you so much for sharing. So for those of you who have said, yes, you have a policy, I'm just curious, building off the case, do you think your policy would be able to guide you in effectively resolving Tom's situation, or are there gaps?
This will come up in a later slide, but I will encourage you all to think carefully about what you do if there is a need to remove an animal. So let's say in this case that we say to Tom, Winnie can't be there. And Tom says, nope, Winnie's not leaving. What is your process? Do you have a process? What happens if the animal, what happens if Winnie was suddenly somewhat destructive? Do you have a process? Is there an appeal process? As someone who's been there, it is far better to have those processes laid out for everyone to read prior to the start of all of this, because the last thing you want to do is kind of figure it out as you go.
That's a great point, Linda. Grievance processes should be clear, available. And Jean's bringing up a point in the chat that it would only guide to the point if it was a service animal. And, making sure that it's easy to find your policies. We want to make sure that your institution has solid processes and that you're able to effectively leverage them when needed. Emily, I'll hold on one second. I'll unmute you. Thanks, Emily. Go ahead.
Thanks. So we actually have a really robust animal policy that's in the Student Disability Services guidebook that we have. It's actually 4 pages that goes through all sorts of different definitions. And then when it goes into the removal, it gets very specific into 5 different points that would constitute the removal of the service animal. So it's really specific. So I feel like our policy would help to guide through the entirety of the process, because it does go into such unique detail about all of the different types of animals that could possibly be on campus.
Great. So the building blocks are solid definitions of all the different types. And then also speaking to responsibilities of handlers. And then I heard you say, Emily, reasons for removal. Do you have in your policy, I'm just curious, any information about direct threat to health and safety? Are there some areas where a service animal or ESA would be appropriate and some areas where it's not?
Yeah, so we have also definitions of the different environments. And so, what constitutes a public area, what constitutes a non-public area. And then if it's not a public area, but you wish to request to have your service animal with you, the process to go through that, which I'm actually working with a student right now who has her service animal on clinical rotations. And so we go through it. It's very detailed.
Great. And Mariana posted many things in the chat from their policy, kind of outlining the responsibilities. Key points are being in control, being housebroken, threat to safety and health of others, the animal behavior. The animal can't be aggressive, things like that. The handler has to have control. The animal is physically ill in an area where assistance animals are prohibited, or the animal enters an area in which the animal safety is compromised. Thank you, Mariana, for that information. We have another person. We have 2 separate policies, one for ESA animals and one for service animals, and then a violation section that outlines the process for the handler or the animal in violation of the policy.
So Kristen Wharton has a question asking if we all require updated medical documentation on an annual basis to continue the ESA accommodation. In our school, we do. We require updated medical documentation from the student. We also require that the ESA and service animals provide proof of vaccination and health, because that's a local ordinance in our town.
That's great, Linda. So my answer to this question would be, it depends on the disability and whether or not the documentation and the information I receive from the student indicates it's a condition that is anticipated to change or resolve. Again, going back to the documentation, there could be situations where an ESA, I wouldn't need to kind of flag that student as needing to provide additional documentation if the disability isn't and impacts aren't anticipated to change. So, we have a question from the chat. What about the online letters that students are paying from online providers who just write the ESA letters? Linda, do you want to address that?
It's a great question, Mariana. So I can say that we've had that happen. I'm sure everyone on this call has had that happen. It taught us some really good processes, if you will, around looking carefully at what documentation we're getting. And so there's some keywords that you may find in those letters. You may find that the person's saying they reviewed Jane Doe's records. Well, how long have you known this person? Once I had a student who lived in California and had the letter come from a physician in Milwaukee. And so I just very casually asked, how did you come to have a relationship with this person? This was pre-COVID, so we weren't doing a whole lot of online medical appointments at that point. And as soon as I asked the question, she withdrew the request. So we ask how the person knows that person, how long the relationship has lasted. There are usually clues in the letters that tell you that this is not necessarily on the up and up.
Yeah, and also the credentials of the individual writing the letter. Does it make sense? Are they qualified to assess whether or not an ESA is necessary to allow that individual equal participation in housing for the Fair Housing Act, or in the case of an accommodation request to allow an ESA in the classroom? I'm just curious if anyone out there has allowed an ESA in the classroom, and are you only allowing dogs, or are there other species of ESAs you've allowed in the classroom? If anyone wants to post in the chat, yes, we've approved an ESA in the classroom, and if it was another species or just dogs so far. So I want to point out there's nothing in the law that restricts species for ESAs. Not a lot of approvals out there.
Have you had that happen, Jennifer?
Yes. I won't go into specifics, but it is something worth considering. Mariana said allowed 2, but limited to the library, and they were dogs. Yeah, more common to be dogs. Anyone else? We have a question in the chat from Kristen. How about special events like commencement? Linda, do you want to take that on?
Sure. So we have definitely had this happen. I work with the commencement coordinator, and we have designated seating that has more space available to it if somebody has a service animal, and they let us know in advance. If they arrive the day of commencement and there's a service animal, we always have extra seating up near the front, and so we'll move them to that location and everyone that they're with. So that's how we've handled that. And we make sure that there are water bowls and shaded areas for animals, and that there's the proper receptacles available for waste and things like that.
That's awesome, Linda. I want to further also say one of the most important things we can do is provide training to folks across campus, not just faculty, because the last thing that we all want is someone coming to a big event like commencement. These are future alumni and their families who could be donors, and our impression of our institution is important in the community. The last thing we want is someone to deny access to a service animal. So providing the information about accessible events, and then also allowing public events, it's so important and vital that attendees are able to make accommodation requests. Remember that a service animal shouldn't have to make an accommodation request, but if they do have questions, concerns, the opportunity to invite them to ask questions, I feel like a lot of issues can be resolved if you provide that information to everyone from the get-go, right?
I think we should move to the next slide, Jennifer, because we've actually covered a little bit on this already.
Yeah, we jumped ahead, didn't we? All right. So, food for thought. How does this apply to your institution? I think one of the major points we've been talking about is clear policies that is easy to locate about animals on campus. And I think one of the key points too is understanding the different rights and responsibilities based on the type of animal and being really clear about that in your policies. If you don't have a clear policy, do you have a procedure on how you're handling service animals, ESAs, therapy animals, and pets? And who is the responsible party for maintaining any records if applicable? Okay, and how would you all handle the animal that was not under control of the owner handler? That's also an important consideration as part of an effective building block of a service animal policy. And a big question that Linda and I want to ask you all, and maybe we can talk about it in the Q&A portion. Is your school in a state or county that allows for service animals in training? So a couple different items for food for thought. All right, more food for thought. What approaches and resources could your institutions utilize to support students with diverse backgrounds and identities? So considering these situations from an intersectional lens, I think is vital. How do we work with first generation students, low income, under-resourced backgrounds, folks that are LGBTQ plus, URM students? And what steps can we take to encourage all stakeholders, faculty, staff, admissions, et cetera, to embrace universal design and inclusive instructional methods which can support students with and without disabilities? I just want to make sure everyone is aware of some important resources out there, including the WAMC webinars, the UCSF faculty training videos, the Docs with Disabilities podcasts, the Docs with Disabilities Initiative website, www.docswithdisabilities.org, the coalition website, coalitiondahse.org. We have a new website for the coalition. Go check it out. The symposium is coming up in June, and the Association for Higher Education and Disability, AHEAD. And we want to thank AHEAD for being such a great partner for us and assisting us with the registration and the Zoom and all of that. So thank you to AHEAD, and thank you to you all for coming today.